Hello everyone, I am Dr. Srinath, consultant neurosurgeon at Innova Hospital, Kompally. Today I am coming in front of you in order to speak about the topic of spinal cord injuries. Spinal cord injuries are encountered in patients where they have been under a trauma such as road traffic accidents or occupational hazards such as working at heights and fall from heights, and domestic injuries where slip and fall from stairs and such heights can lead to spinal cord injuries. When we hear a patient of spinal cord injury, the most common symptom which we encounter is pain at the site of injury, followed by a deficit or complaint of weakness or numbness in the part below the level of injury, and also the lack of control of the urinary control and the motion control. So most common conditions where this is encountered is the road traffic accidents, where the mode of injury cannot be exactly determined. All such patients with a head injury and neck pain are deemed to be having spinal cord injury and therefore have to be compulsorily evaluated for such conditions. In patients who we have clearly determined that they have a presenting complaint of a weakness or numbness, the stabilization of the spine is the most important thing which should be done at the site of injury itself, and transport should be under strict immobilization conditions in order to avoid the increase of injury, and also in order to avoid the patients who are on the borderline of injury and on the verge of incurring a nervous injury, so that the protection of the further damage from the trauma to the spinal cord is avoided. And once the patient reaches an appropriate institution with facilities for spinal cord injury such as CT scan or MRI of the spine, the evaluation is done, and therefore the diagnosis of spinal cord injury is established after MRI of the spine. Depending on the severity of the injury and the location of the injury, there might be other associated problems such as polytrauma, injury to the chest, abdomen, which also have to be evaluated. In patients with cervical spine injury, we usually encounter weakness of both the hands and the legs, and difficulty in breathing, which may need to be managed with placing the patient on the ventilator in order to give assisted respiratory capacity, additional respiratory capacity, and augmenting the diminished capacity of the breathing of the patient. In such patients, we usually advise the patient to undergo a long-term respiratory rehabilitation with tracheostomy placement, and also gradual respiratory rehabilitation measures such as chest physiotherapy, incentive spirometry upon gradual recovery. In patients with such severe injuries of spinal cervical cord injury, we usually manage the patient initially by giving the patients steroids which decrease the inflammation or swelling in the spinal cord, and also give a better result in the future in respect of recovery of power and as well as sensation. So in patients who have been established with such injuries, the damage to the spinal cord, which may be permanent, cannot be managed any further, whereas the injury to the skeletal support system around the spinal cord has to be corrected and given appropriate support by placing of implants, removing of the damaged bony parts, and giving augmentation to the structural integrity of the spinal cord. In patients with dorsal spinal cord injury or the level of chest, the weakness usually presents in both the lower limbs only, and therefore the result of management of the future is better in patients with having preserved upper limb function. In patients with having injuries to the lowermost part, the lumbosacral part of the spinal cord, usually the bowel and bladder involvement is more, and usually in all patients we expect a gradual improvement in such condition after surgery and rehabilitative measures. In patients with permanent neurological problems such as weakness or numbness, we advise appropriate measures according to the degree of injury or degree of damage to the spinal cord. Patients may require assistance with the devices such as calipers, walking frames, and also extensive physiotherapy in order to maintain their lower limb anatomy, muscle structure, and as well as to prevent complications such as pressure sores, which lead to further infections and other seriousness. So when we encounter these patients, the most important factor becomes the physiotherapy and occupational rehabilitation, and counseling of the attending family members in order to give the exact environment at home for the patients to undergo full recovery. We usually give the patient a good psychological counseling also, so that he recovers mentally also. We advise all such patients to take the exact appropriate advice from the local neurosurgeon for the best result. Thank you.